thank you all for joining us. Before I introduce the legend, I just want to thank you all for tuning in for the first live Her Journey episode with a very special and honored guest, someone that's been massively impactful in my life. And I know a lot of you might have heard about him or seen him in promos or seen him on the street sometimes. But it's my honor and privilege to introduce you to none other than Dr. Brown, the legend.
So dramatic. Hey, Gavin style. Gavin, you're just looking better than mine.
I'm trying to catch you up. I'll catch you up, man. Catch you up and everything. Yeah, so, having known Dr. Brown for years and years, like when you first started Northshore, I didn't know how we even met, but it was just through Bermuda vibes. Then a patient at various times, for various reasons. We got cool, and then along the way, I started hearing about this thing called this Turkish hair transplant. And I remember when we first talked, but I remember first talking to you about it was you had just started to do some of the hair products, like the
medical hair restoration stuff.
Like
absolutely.
Vitamins and
the injections, PRP, mesotherapy.
And I was like, I felt like I was a totally hopeless lost cause.
And I would have agreed.
Exactly.
I'm not baby Jesus. I can't turn water into wine or a desert into a forest.
You see right there. Like this photo that you see behind me, drawing us. That's the before.
I said, cousin, I don't know.
Yeah.
And I did turn you away a few times.
Oh yeah, because I was like,
just having to come back for something else. It was one of the other clients. And you said, hey.
And the thing was, I had learned about Turkish hair transplant from somewhere, and I was like, there's only one person I could ask about this, and that's like Dr. Brock. To be honest, I asked my regular GP, and they were like, they recommended you. So then I was like, well, next time I see you, I'm gonna pull up. Next time I saw you, I was like, so Turkish hair transplants. Actually, no, that wasn't it. Sorry. Live, so we're gonna talk the stories through how they go. Welcome everybody, some people rolling in. You're tuning into the Hair Journey Chronicles with Gavin Smith and my illustrious healthcare provider, that's the American man making this happen. So I heard about the hair transplant. I was sort of checking in on it every now and then and started mapping out, how do I get to Turkey? How many flights is that? How much is that going to cost? It's going to be crazy. And then it's also going to Turkey. Like, do I want to go to Turkey? And then do I want to go to Turkey? They got a procedure. I don't know. And then is it weird for me, Gavin Smith, to get a procedure? But everyone be thinking like, Gavin got his body done. That's weird. Which is a big thing, because a lot of my
You guys are a very natural community.
Exactly. So it's like, if I'm like the roots community guy, and
couldn't get a cosmetic surgery.
What does that mean? Reputation. What does that mean for me? My brand and how people feel towards me. And then over time, I was just like, I kept kind of coming back to exploring what it would be like to go to Target and do the thing. And then I saw your first sort of wave of advertising saying that it's going to be available locally. So that's when I came around here like a slingshot. I was like, hey, so talk to me.
He just rolled up
and like, yo, what? I put up like that. And I was like, tell me what's possible.
And I was like, I don't know, cousin.
Yeah. Because at that time, I think you might have had your first cohort.
We had the first cohort by that time, but he was in our second cohort. So, he was fully shaved. He was probably worse than this picture because he was fully shaved. So I'm like, cousin, first of all, why do you even want to have her, but you look pretty decent bald? And who wants to go to the barbershop and have to pay for that, right? Like you can just shave yourself in the shower or something. But he wanted hair. And I'm finding more of my patients are really interested in that, and I'm confused, and I like to understand the why. And we'll talk about the why, actually.
Yeah, well, the thing that for me is, I mentioned it earlier, options of what true wealth is. Wealth is having options. It's like saying, do I want this car just because it's trans, or do I want this Tesla? Maybe not Tesla nowadays, but you know what I mean. Do I want this next level car because I could have that option, have that luxury. For me, having hair is gives you the option of shaving your head if you want to, or growing your hair out if you want to. And ever since I lost my hair, which was around mid-20s, I felt less.
So you've been bald since 24.
Yeah.
And now
so
you're
I'm
like 40.
46 now. And
Oh.
like when my daughter was born, she's 21. She doesn't remember me with dreads. You know, she doesn't remember me having hair at all. She's never seen my hair until now. And so at first it was like basic haircuts, but didn't really feel like I had a look. And once I realized that no matter how short my hair was, you know, the receding hairline, reality is that a short haircut with a receding hairline looks a little and so once I started to actually shave, figured out how to shave well, I was bald from that point on. I was like mid-20s. And so in our first conversations, one of the things that they talked about was how it's beneficial to have, you know, some hair growth so you can get a sense.
Yeah, grow it out so we can see if it's possible to harvest, right? We're harvesting from something. We need to make sure that that something is there in that feed in here.
And so that was when the first conversation till surgery time was probably like 3 weeks for my journey. And that was a terrifying 3 weeks. Actually, I didn't tell you about this. I didn't think I told you guys about this. I remember sitting Mark. Mark's like my best friend. Mark Daniels, big up Mark, and Kimmy and the girls. He had a dinner at his house. We were kind of having a get together, bunch of the group, about 5 of us sitting around. And I said, look, counsel, I got something to tell you and to share, and I'm terrified and I don't know what to do. So I said to my boys, I was like, look, I'm thinking about getting a hair transplant. And let the fireworks begin. Debate.
I know Mark.
Yeah, and Mark's a lawyer. So it's like, and he was supportive, and Ewan was supportive. Ewan was probably the only one that was like, nah, bro. And Danny kicked in. It was a good little conference on like, what does this mean to do this? And I think I left there feeling like, okay, guys didn't overreact. They didn't freak out and get, you know, upset or nothing. And I felt encouraged because they're like, look, this is what you really want to do, go ahead and do it, bro. And from that point on, it felt really comfortable to be able to just do it, but to also go public with it. Because going public with it was the other side of it that was worth considering, and which I had to consider because I'm always been this guy or that guy.
Yep.
So it's like
completely bald in the desert.
How do you go from that guy to that guy without
having a conversation?
Yeah, having conversations with everybody, being like, I'm saying, yeah, no here, not even here. So I was like, well, cool. Dr. B, let's roll, man.
So yeah, so you came in, you was completely bald, and I'm like, I don't know if I can work miracles, but you know, grow it out, come back in the next few weeks, grow it out, because the guys are coming in soon, and this is our second cohort. But now I've done so many now, we've done about 70 transplants here in Bermuda. You know, let's see what's possible. And we didn't see this as the possibility. We didn't see that his donor area was so thick and so well matured because he's been shaving it for the past 20 years, 20 plus years. He didn't even know himself. So this is all a new reality. Ace Boy that had his first haircut in 26 something years.
Yeah, on Thursday. Big up luxury cuts.
I know a fast forward all over the place, because it's just
so
I'm in awe.
If you look right here, I mean, you can see
ivory.
And actually, I think we got a video that kind of documented that journey that's going to be coming out. But as mentioned to you earlier, getting your haircut as a black man is like a rite of passage. It's a part of the culture.
It's a community. It's a
experience. Yeah. And I missed it. And I've forgotten how much I actually missed just the self-care process of going to just get groomed, get your haircut, you know? I remember going as a little boy all the way through. I remember going to Ricky Spence. I remember going to
they got Ricky Spence. There was my barbers back in the day.
And Carvin,
yes.
Like those are my boys that cut my hair from long time. And even Gina Spence, not Gina, local Gina. Talking about Gina, the sister, Sue.
Yeah, she does all the natural products now.
Gina was the one that actually dreaded my hair. Like I was a long-term customer, client, family, crew of that whole thing.
Family.
So when my dreads started, it started there as well. That's the last time I got my hair cut, and then I got dreads. And so in returning to a barbershop experience, it was quite nostalgic and felt like not like I belong, like I fit in, but it was just something that I missed. You know, because you think about with men, there's very few men spaces where you go to kind of reason, particularly outside of just your close up. It's like the barbershop, church, maybe if you're on a football team or something. But outside of those spaces, they're rare in regular life. And it just made me ponder like what's going to be like to go to the barber on the regular, like only once a month type of thing, or every 2 weeks or whatever. Like the ritual.
2 weeks. 2 weeks.
Yeah, for real. Especially with all the gummies. I heard me pop.
Yeah, every 2 weeks.
Yeah, and that's so we were talking earlier about some of the benefits of getting it local. I've talked to the audience at times about the sort of aftercare options that are available. I don't know if you want to like lean in, and if anyone's got any questions, just fire away.
Yeah, fire away. We want to make this as an open dialogue as possible. But yeah, the aftercare, we have to see you back the next day to remove the bandages, the day after that to do your first wash. And Gavin, in his build personality, the next day you won an award, you get to be on a panel?
Yeah.
With your scalp all bloody and
that was
just been like you've been through a war.
Yeah, so unfortunately I had a pre-scheduled thing that was months in advance. And it was the procedure that was the late day before schedule. So I told my team, I was like, well, I'm not going to do it. And they got so adamant. They were like, no, you have to do it. Like, so whatever you have to do over there, like, can you reschedule the procedure? I was like, no. Like, I was like,
people are funny.
Yeah, for real. I was like, this is like massive in so many ways. But they were adamant, and the reason they were adamant was because I was receiving a award for some of my community work with young men. And that was the first real trial by fire, because like, look, I had to take the bandage off to go on the stage.
I gave doctor's advice, but he did it, and he did well as a result of it. But the point that I guess what he's trying to make, and I'm trying to make, is that aftercare, it's a breeze, right? There are some stats, there are some rules that we would like ones to follow to maximize the survival of the grafts. I think he even bumped his head in the fridge or something and thought he lost some grafts, but clearly things are looking quite great. That is manageable, right? Talk to the people about the actual process. Is it painful? That's probably the biggest question I get on the streets. Because they see it looking all bloody, and you saw it yourself. Did you?
Yeah, it looks.
You want to be awake, and you're normally awake for it too anyway, but it would make you sleepy. But Gavin being Gavin, he wants to be, okay, what's going on?
Yeah, I scared myself. Because you don't want to see it happen.
Process.
Yeah, because I mean, when you think of a hair, you think of like, just a hair. But when you think of the hair and the root and maybe like the surrounding flesh,
blood and everything.
Yeah, it's a gory process. It's a bloody area. Through the process, you're kind of in and out of this and all. Actually, it was one of the best sleeps I've had.
Best sleeps.
In a long
gives a really good medication to make you comfortable.
I woke up at the end of the day feeling rejuvenated and rested for real. And the times that it came to was observing the process in the mirror, in the camera, and just talking with the doctors, which was its own sort of additional sort of comforting thing, to be honest, because it didn't feel as scary as it actually looked. Now, apart from that, the sort of once the drugs wore off the side of it, which would have been like later that night, it wasn't bad. And I've likened it to like getting a tattoo. So
some soreness.
Yes, it's soreness, it's tender, it's a little bit like maybe like a low grade headachy type of feel, but nothing so significant that would be a pain deterrent. The most uncomfortable, challenging thing would have been the having to sleep upright and not like lay back on a pillow. Also not able to wear a helmet, not able to wear a hat for like a month, which was meaning you're feeling not your best. You're feeling like you're looking your worst. You're feeling like you're looking like Frankenstein. And it's on your head, so it's not like you can cover it. It's not like it's a part of your body you can cover it up a little bit. No, everywhere you go, there you are. And so you just have to kind of get through it. But after that first month, that first time being able to go to sleep at night and put my head on the pillow,
this is the best sleep you ever had in. So after day 10, once we take off those scabs, then you can wear like a hat or work a do-rag or something if you have to.
That's what he says now about that. My cohort, he told me a month.
Yeah.
So I was a month of like catching lifts and bus and being on a bus.
Everybody watching.
Pro tip is go to the back seat. I mean, I always go to the back seat anyway. Go to the back seat. You don't want to be in the seat just before the back seat. We in the mid bus because then they just got that birth. They're looking at your hair like this.
Bird's eye view.
And you're paranoid that everyone's looking at your head, and they are. Because
everybody's interested. You know, this is like the Turkish experience.
Yeah, for real.
Seeing you on the bus. But yeah, so you tell the people that the process wasn't painful. You were 6 hours on the table. You were sleepy during it. It was comfortable after fact. The most uncomfortable thing was just the sleeping on that elevation. What else?
I mean, there's light gray itchiness that would happen, particularly in that first 10 days before they took the what's the thing called?
The scabs.
The scabs. So it's like it's like you put the serum as it made like a little shell.
Yeah, we did PRP, so that helps the healing process. So the graft just to be as viable as possible.
Look like a little weird skull cap thing, scab, and that's what actually got damaged when it hit my head. And so it bled out a little bit and created like a bit of a stain, which was strange. But that I was really mindful of not interfering with it, and at times it would get a little itchy maybe, but nothing too. It wasn't bad at all actually. Yeah, but when you think of what it is, I was surprised by how fine it was. I don't necessarily have a terribly high pain threshold.
Most men don't, and you know, we thank the Lord that we don't have those monthly episodes because that wouldn't work for us.
Well, we'd been prepared.
We'll get some drugs.
Yeah, for real. And I never took painkillers.
Oh, you didn't take your painkillers?
Never at all.
Because we give you painkillers, we give you aftercare medications, a lot of the stuff that you wouldn't necessarily get when you go to a Turkey clinic. And you're at month 8 now. Look at the hair. And look where we started.
And one of the things that was interesting about that is that you can see how towards the back, it looks like, okay, it's still got some hair back there. But as the hair grow even more, like at this level, you saw that there was actually a big bald patch at the back as well, which is sort of like back here a bit. And even now, like it's felt like every week, like week to week, day by day, in the last month, it started to really thicken up.
And it will. And what we've noticed now, because we've done over about 70 something different transplants on patients that hair grows differently by ethnicity group. So our Portuguese patients, in 4 months, they'll have a whole full head of hair like they just woke up like this. Where our Afro-Bermudian patients, 8 to 12 months is usually the time frame where we're starting to see this. I saw Gavin last week in preparation for his May 24th debut as the host for Bermuda Day, and it did not look like this. It looked like, okay, it's growing, definitely better than it was. And we may even have one of the pictures in the presentation. But
it was also interesting because that was before I got the haircut too.
Yeah.
So it's like,
no, actually, I don't have that shot of where you look like just the other day. But look at the guy. He's in the game. He is in the game. And this is where he started.
And you see, like, sometimes you see some of these shiny patches, you can see my scalp right there. Like, that's the thing I've been monitoring. That's when that's going to sort of
thicken up.
Yeah, where you can't see my scalp no more. And it was really stressful for me like a month ago with that, because it was like, oh, I think it's going to be terrible. It's going to look, I went from being bold to looking like losing my hair.
Like, absolutely. Like, Gavin has been the best and worst patient that we're here because, you know, he's hypersensitive to everything, and he's like, guys, listen, May 24th is an unmovable date. I am on TV and I can't be looking all patchy. I'm like, Gavin, just relax. It's a process. You're going to do fine. And so said, so done. It just took 8 months, and that's normal for patients in the Afro-Bermudian race. And looking at him last week to now, it's starting to thicken up.
So that, see, I can sort of see these shiny parts of my scalp. That shyness was getting back here like 2 weeks ago. And that's what was really concerning, because it's like you could almost see through my hair straight to like what was behind me. But that's all
starting to blend in.
Yeah.
And when we're looking under the microscope, we call it the dermatoscope. Because when we transplant hair, it's just like transplanting plants, right? We're transplanting groups of 2s, 3s, and 4s, and then some singles. When we transplant it, it first grows as one hair fiber, if you will. And then over time, that it starts to get 2 and 3 and 4, etc. So he's still in the very early phase of just having some singlets. He may have some doubles, some 2s, but he's not at the 3s and 4 stage. And that's when you get the increased density. So he's got a ways to go, and look at it. It's only 8 months and it looks really, really good. By 12 months, you're going to be like, okay, I don't see nobody's scalp. I look like this the way it was just naturally designed.
Right.
And that's one is a bit of artistry and then science.
Yeah, one of the things that I've talked to people about that, like, they're looking for advice on what to do and what to think about, what to consider. And the thing I say to them is hairline design.
Mm.
That's a thing.
It is the thing
that I didn't really consider till like day of operation. Because you kind of just like, okay, yeah, I'm gonna bring my hair back, but you know that's about all that is. But then it's like when what's your boy? The doctor name? Your boy, the tech guy.
Yes. You got Aiden.
Yeah. When Aiden was, this was using a chalk.
Yeah, use like a
marker,
eyeliner white marker.
Yeah.
To to
it's just
get
like
different grades.
It's getting like, it's like that was good. I was like, hold on a second. Well, what about? And then so we had some, and then he talked about how you see when you put your wrinkles up, your eyebrows up,
your frontalis muscle,
that you can't put any of her where the muscle.
Absolutely. Yeah, like a pro now, right? You need to start joining our clinic. So we can transplant on the frontalis muscle. So your hairline starts just after the muscle. So if you're a male now, you look at your forehead, and if your hairline is a big space between where the frontalis muscle ends, which is here, to where your hairline begins, then you know that you got some male pattern regression there. And for him, and for every patient, we want to be able to give them a hairline that looks natural and youthful, but not something that looks artificial, looks like a bucket, if you will.
Yeah, they emphasize the whole like age appropriate hairline too. So some people want to be like looking like they're about a 20-year-old hairline, let's say, which would just actually push the unnatural synthetic. You got your body done look versus looking like this, you're just born with it, and it's not Maybelline. Yeah. And as a reference for that, I don't know if you ever check out Acorn, but Acorn's, if you look at Acorn's hair transplant, Acorn went to Turkey.
I know, you mentioned it all the time, and so is all the patients.
His hairline looks like not what I would have wanted. And so when it comes to hairline design side of it,
artistry is important. Yeah. And try to, and this is where, I guess having the English connection, having the cultural connection, we're able to look at your old photos and also design something that's unique to you and that looks very natural for you.
Like when I think about the areas that I would like to see, maybe like, because there's some side work that's like, but I'm really looking forward to just the sort of 12 months to see where the thickness is. And one of the conversations that I've had, not discoveries, but as the journey's going on, learning about other things to do to prevent hair loss. Like I was too late for hair loss because
he came to advance
science weren't there yet.
But just
come on, Acorn. Like look at that. Like I'm saying, I'm happy for him. He's happy about it, but that's hairline design. So think about your hairline design before you come through and check my boy Dr. B.
Yeah, absolutely. And bring some little pictures that help.
A better result.
And so apart from hairline design, the process of growing, the process of actually coming down to us here at Northshore for your aftercare, because that's one of the things that you wouldn't get by going to Turkey. And I'm not here to sell the process, because the process sells itself. But I need patients to understand that we're just down the street. If you have any sort of complications or any questions, you just roll on up, as Gavin would say, and most of our patients do. And we're going to support them through this.
You can at least key his car. You know what I mean?
Yeah, if I freak you up, But we do guarantee 95% survival of the grafts, and our team comes through every other month. So if there's any issue that has to be resolved later on, we can always touch you up and do that for free, because that's the type of aftercare and guarantee that we give to our patients.
And one of the primary question tends to be, did it hurt? And the second question is, how much did it cost? And then the comparison of like, is it cheaper here or there? Fundamentally, if you look at all the mechanics that go, financial logistics of figuring out Turkey versus figuring out local, it kind of balances out. On top of that, you save yourself a lot of time, energy, and risk, because you ain't got no sort of way to cover any issues. But like you just said, the preventative can come on and pick up a fuss.
Absolutely. And your first haircut after 20-something years. Tell us about that.
Yeah, so in going to luxury cuts, big up to Kenton, Truck, and Ivory.
And Kenton as well had a hairline replacement as well. Ruas had his frontal hairline replacement. You will probably show his pictures on our website. So he's in the match as well.
Yeah, so that first haircut was just, it was a treat, and it was it brought back a lot of memories, And it was, I said to Ivory, I was like, look, do whatever you're gonna do, bro. I'm not even gonna give you no insight. I was like, the hot boy haircuts, hook it up. And he did the whole thing, and I'm gonna lie, he did the once I heard because I like close my eyes to try and just be in the moment and not worry about directing it and be like, I need to have a boxy fade with a line. I didn't do nothing. I just said, look, go ahead, do something. And he did the airbrushy thing. I heard shh.
Yeah, we all get a little enhancements. Even us regular people get a little enhancements. Some people a little darker, a little lighter. Because he's new to the match, he didn't know what he didn't know how to run the ball because this was a little dark.
Oh, and it was getting ready for showtime. So I probably wouldn't get the spray can thing, spray can
enhancements.
But I felt good for the show, and that's
absolutely
most important.
And Tino was like, Lord, shit's going great. The Premier's got a new election, and Gavin's got here. Like, the future is now.
I know, and right here in Bermuda, so you can get it yourself.
Absolutely.
And one of the other things that I've seen people, I've been impressed and surprised by how many women have been vulnerable. I talk a lot about the guys in different platforms, but women tend to pull me aside and be like, talk to me about, is it possible for women?
Absolutely. And we get a lot of women. Unfortunately, women are not as open. They're more private, especially here in Bermuda, when it comes to this sort of situation. Hopefully we will get some that are comfortable to go in there, and probably once they get to the results that they want and they're happy because they're still in the growth phase, maybe we can convince them.
Has there been any differences between women and men?
Other than we don't have to shave off their hair. So we just shave the back, open up a window, especially if they got long hair. We don't have to shave the whole scalp. Some ladies do because they need more of a transfer. But most women just want the frontal hairline because they've been using braids and extensions. So that pulls and traction has pulled out their edges, if you will, while you're just able to transplant that without shaving off your whole head.
Have you seen any like extreme female cases yet?
Oh yeah, we've done
like how extreme mine was.
Not as extreme as yours. We do have some cases that are coming up for our September visit that are quite extreme, where we have one lady, we're transferring everything from the sides to the scalp, and that's something that she's agreed to, because she's like, I'll rather have hair on my head top.
They could cover the sides.
Because we've done that for men, actually. Some of our men in our last cohort was like, I don't care about the sides. We can both fade the sides, but I want the hair on the top. So we transfer everything. As well as for men, we can take some of the excess, like, down here, if you don't want this beard hair, we can transfer that to the scalp as well.
Would that be a different texture?
No, this looks quite the same. And you mix it in, right? So
it's just like filler.
Yeah. You just mix it in.
That's interesting. Can you take it from other parts of the body?
Someone's
got like a hairy back. I don't need to hear my back. I need to hear my head.
You can take it from
I don't have a hairy back.
You can if you're desperate for it. It's not something that we advocate for because you're really an advanced case and we've got to still take pubic hair and back hair and armpit hair and stuff like that.
Plus that hair wouldn't grow as long either.
Yeah, but you'll put it in a way where you'll put it in the front. So your front hair is normally more softer and more finer versus the hair as we graduate. Through the scalp. So it's all So we do eyelashes. No, what's it? Eyebrows, sorry. We do beards and full hair. Go ahead.
Learn something every day.
And what we will be offering, which is probably the first time me talking about it, is a biosynthetic hair. So we've had patients that's like, can I, use any other hair? And the answer is yes. There's biofibers, which is synthetic hair that we implant into the scalp. Say, for instance, you didn't have a good enough donor area. We use biosynthetic hair, and we implant that, and that lasts for years.
So it doesn't grow; it's just there.
It doesn't grow though. So once you cut it, install it, it's there.
Wow.
And you get only 10% that will fall out a year.
So you're embedding strand of hair.
Right into the scalp.
What's it made of?
It's a biosynthetic fiber. that mimics natural hair as much as possible. The future is now.
Like how you were talking about the sort of one follicle has sort of.
They come as that too. They come either in singlets or groups of 2s and 3s. So we can give artistry.
And so theoretically, if someone was to get that, if someone's fully bald and they got that in their whole head,
Mm-hmm.
it would look like a weave or something.
It would look like regular natural hair. You wouldn't be able to tell the difference. And for even some patients we will be that don't have as much coverage because their donor area is poor, we can intermix some of the biosynthetic fibers. It comes in all sorts of, just like weave hair, it comes in all sorts of lengths, colors, textures.
And then once you cut it, that's what it is.
Once you cut it, that's what it is.
And if you want to like grow it out again,
there's no growing
surgery again. But like
you just get it. Yeah.
That's amazing.
But that's perfect because you have a perfect you.
Not for me.
Well, not for you. But this was like your natural. This was like your natural.
I had this option.
It just stays like that. You don't have to go to the barbershop.
Yeah, that I'm looking that up tonight.
Mm-hmm.
That just sounds
biofibers. Yeah, the future is now. So we'll be offering that soon. And there's another one called I can't remember the other name of the fibers, but there's 2 that are FDA approved now that are on the market. They've been on the market for quite some time. It's not cheap though. But it is an option that we'll be offering soon.
So what do you tell people, like, because I've had a few people that have been nervous about the sort of, even just like knocking on the door, the consultation side. They felt like it's so, I'm encouraged. I'm like, look, you can go by and get a consultation.
It's private. We're not going to speak to you in the middle of the car parking lot or in the middle of the lobby. We bring you into our private room. We address your concerns. We give you realistic expectations. We're not salespeople. Like, listen, I'm not here trying to make money off of people doing multiple hair transplants. It's, I'm fine just the way I am. But I'm here to give people options and give people confidence, right? And if we can provide a service for you that's going to be reasonable, that's going to have low adverse or side effects, then why not? And we give you all those options. And some people, like in Gavin's case, we actually said, cousin, we're not baby Jesus. I'm going to give you the realistic projection. But, because he was persistent, I said, grow it out. We're not going to say no, but I don't think it's possible. But look what's possible.
And that was me because I was so bold for so long.
Mm-hmm.
No one knew how much donor hair I might have.
And he didn't even know after 20 years.
Yeah, for real.
Mm-hmm.
One of the questions I've had, I saw someone mention it, is this thing around insurance. And does insurance cover everything?
This is fully cosmetic. The only thing the insurance is going to cover is your medications, if you have insurance.
And you think there's ever going to be a possibility for insurance to kick in?
No, not the way things are going now. This is purely cosmetic. It's cosmetic all around the world. But cost is relative, right? So for $3,500 to, I think the maximum surgery we had was probably about $6,000 because the amount of follicles they had to transfer.
In one session?
Mm-hmm. In one session. Yeah. And Aftercare and everything's included. All your other treatments are.
Are you able to talk ballpark on the pricing, or is that
between $3,000 to the maximum we had at $6,000? The average person comes in for about $4,500.
Yeah.
Yeah.
And the best part about it is it's for life. Mm-hmm. So it's not like you gotta come back and
most people it's one surgery. You got people that were advanced, like we thought you were, and we thought that you may have to have another transfer, but you're doing quite well. This may be one and done for you, cousin. But if you needed to have more, you got your donor area is so mature and it's so full, it's ripe for the harvesting. So we can put more there if we have to later on. But if he does what he's got to do and takes his supplements, his gummies, his DHT gummies, which are only like $25.
What does that do?
So that blocks the hormone dihydrotestosterone that causes the destruction and miniaturization of the hair in the first place. It causes the hair follicle to lose its blood supply, if you will. So that's the underlying cause. Whoever has transplants needs to do this. If they're not doing it, they're going to lose their investment over years and they're going to end up having to do it again. But for Gavin's case, because he's on the right combination, which is the DHT blockers, and then also the DHT blockers that we put as drops, topical drops. That's it, gummies and drops. How simple can I make it?
And if someone is experiencing premature loss now, they could
start that regimen and reverse it. If you go to our website for that, as I said, for the past 15 years, we've been only doing medical hair restoration. It's only now that we brought in the Turkish team with over 20 years of experience in doing transplants to do it and assist me in doing it here in Bermuda.
What kind of results have you seen from just the restoration?
Amazing. Amazing results.
Like when you first seen all that years and years back, I was like, whatever, bro. Snake oil, cool. Keep it moving.
You did say that.
Yeah.
Very boldly. Like, if you my consultation, I'm a published expert speaking around the world and talking about snake oil. Like, have you not done your research with me?
No, I had, and also I was just like, I was
but this guy, he speaks his mind. I love it.
My heart was already broken. I was like, there's no way to this. I was like, if I take these, and I was already too far gone.
And I told him that he was too far going, so I'm not even going to recommend him taking the stuff, because that's how realistic I am, right? I'm not here to sell products and sell oils. If it's not going to work, I'm not going to risk my reputation on selling you something that I know is not going to work for you because you're too far advanced. But this is now where we now offer transplantation, so we can do the whole gamut, the medical patients as well as the patients that need surgical restoration.
Yeah, whenever I see a young man that I see is kind of starting to have pushback, I'm like, look, take it easy on me pulling your hair back type of thing.
Yeah, the basic rigs, the extensions, the
big
dreads.
Yeah, and then I said, like, you should probably get on your game.
Get them the drops, get them the gummies. They're available at all pharmacies around the island. The over-the-counter products, if you want the prescription products, you come here to us. But the over-the-counter products works just as well for patients with early signs of hair loss.
And what about like minoxidil and those types of things?
Well, minoxidil is one of the ingredients in my products, but minoxidil is only one option, right? It's like baking a cake. You just don't need eggs, right? You gotta have the whole package. Minoxidil just being one.
Yeah, many match for sure.
And tell people what else you done, Gavin, because we also got some fillers and some Botox. So I did some fillers under his eyes, some nasal little folds. We did some Botox. The Botox is kicking in now. It's been just a few days.
Like, cause as you get like,
he was looking tired. Cousin was looking tired.
And I'll say, figuring out depression stuff too, like coming out of that. Your body keeps the score, as they say, And so I remember seeing a few pictures of myself where I just looked like, actually pictures of myself as well as wooden pictures of myself, as well as people being like, what's wrong with you? I'm like, I'm fine. But then you'll see a glimpse of yourself and you're like looking like you're vax of the world. And I used to be. But I'm not no more. I don't have that face when I'm actually happy and doing the things I love to do.
But he was like, did men get this? I'm like, cousin, the amount of guys, construction workers, bodybuilders that come in and get treatments, aesthetic work done, you would not believe. And of course, because it's Bermuda, your secret is safe with us.
Not my secret, apparently. You heard her first. And
you haven't got Botox and fellas.
And although it was totally weird, amazing, because it was like instantly a different look, and we might share some of these pictures later, but it was really just to take out a sag. And one of the reasons why I was actually comfortable with it was because there's no way to deal with that. Like, you can't go to the gym and work that out. It's like once you kind of got
once you lost that fat in the face and you have that sunken look, the only way to do it, to restore that, is through filling it whether with fat or, in this case, hyaluronic acid filler.
Yeah. And part of my sort of journey that I'm on right now is like, I want to be my best self. I want to feel good. I want to look good. I want to do good. I've been used to doing good for the longest. I'm sort of, you got to build your house.
That balance, right?
So, grow and be more.
Absolutely. It's that balance. Like, you're not doing anything too extreme. But the hair transplant may be an extreme transformation compared to this. But, the process of getting it done wasn't significant, wasn't painful, wasn't like, you was crying for your mother or your girlfriend for weeks because it was that painful. It was comfortable.
Yeah. It's just a little bit weird.
Yeah.
And now it's actually weird to think about myself when I was bald. Like, because now I'm telling you.
That's what you said earlier. Like, you would hate to go bald again.
Yeah, I would. Like, when I've done my research on hair transplant journeys, most people that have gone through the process never shave their head again. And I think we had a conversation about this in the beginning, because I was like, if I don't like it, if I just don't like my hair, if I actually prefer being bald, can I shave my head and go back to just being bald again? And it was like, yeah, it should be fine. And it was like the should be fine was cool, but I couldn't find any pictures, any evidence of this, like around the world. Like, no one that's gotten the procedure has gone back to shaving the head. So one thought I have is maybe shave my head at some point before growing it right out, just to see, is there any permanent scarring or anything going on there? But every time I do like this, when you're looking at it on the microscope, it just looks like this part of my head was just like this part of my head.
You did mention that you was afraid to go bald again because you're like this. You like having hair.
Yeah, I can't go bald again unless I shave it once.
Well, Gavin's in the match, guys.
Mhm.
So any questions, shout out to us. If there isn't any,
Yeah. Keep
you know,
moving.
they want to keep moving.
And tune in next time. Actually, I told them they might do a tour of the place, but that ain't serious right now. Because if you want to see the place, come around.
Come on.
Yeah. You want to put any... Oh, I heard there might be a special coming up on consultations.
Yeah, so for just mentioning Gavin's name, there's a free consultation. So, we're here to support the community. Come on in. There's no charge. Just mention that you heard it from us and from Gavin, and we'll hook you up and we'll give you a quote and you make an informed decision of something you want to proceed with. Our next clinic is in September. We're already half full for that. And after that, we're doing monthly clinics until March. So we're going to be very busy during the winter period, which is the best time here in Bermuda to actually have your transplant.
Yeah, I was so glad that I got
During
mine
the
in
winter.
October because it allowed me to really just not be only seen as much.
Yeah, you're not out boating, sunning, swimming, and all that type of stuff where you can,
Like I overheard someone at the checkout, at the reception, just looking at booking it for winter, specifically for the following winter. So they're planning for it, but for that winter.
Yeah.
And so you can book that far in advance.
Yeah, I mean, we're here for the long haul, absolutely.
All right.
And so you just give us your indication of when you want to do it, and we put you on that waiting list for when those visits come about.
Yeah.
Look at this, guys.
From that to that.
He's in the match. He's in the match.
It could be a lot worse.
Thank you, guys.
Thanks to Dr. B, everybody. All right, tune in again next time. That's up, Evan.